In the dead of a February evening in 1994, something walked into the emergency room of Riverside General Hospital, and within moments, it began poisoning those who tried to save her. Doctors collapsed, nurses toppled, a hospital wing was evacuated. The patient died within the hour, but her body seemed to turn into a chemical weapon. What dark alchemy coursed through her veins? Tonight, we unravel the baffling story of the toxic lady, Gloria Ramirez, a medical mystery that still haunts doctors, scientists, and conspiracy theorists decades later. You might think hospitals are places of healing, but that night in Riverside, the scene became one of terror, confusion, and lingering questions. Stay with me, because what follows is a journey through strange symptoms, fragmented clues, wild theories, and a mystery that hasn't been fully solved. She was 31 years old, a mother of two, locked in a battle with advanced cervical cancer. Her name, Gloria Cecilia Ramirez. On February 19, 1994, paramedics were dispatched to her home. She was found confused, dizzy, breathing unevenly, her heart racing, signs of severe distress. She was loaded into the ambulance, placed on oxygen, and rushed to Riverside General Hospital's emergency department. When she arrived, she was in critical condition, barely conscious, with dangerously low blood pressure, a rapid pulse, shallow breathing. The ER team sprang into action, treating her like any serious emergency, stabilize the vital signs, monitor her heart, draw blood, administer medications, shock therapy if needed. But from the first minutes, strange details emerged. The nurses who removed her clothing to place defibrillator pads noticed an oily sheen on her skin. A faint, sweet, garlic-like odor hung in the air. When a nurse drew a blood sample, she reportedly saw white or manila-colored crystalline particles floating in it. A doctor who leaned in to sniff the sample later fainted. Others nearby began to feel dizzy, nauseous, some suffered muscle spasms or convulsions. Within 45 minutes to an hour, Gloria was declared dead. By then, 23 hospital staff members had fallen ill, and 5 required hospitalization. It was as if Gloria, in death, had become radioactive. The emergency room was evacuated. Doctors donned protective gear. Hazmat teams were called in. Yet authorities found no trace of known airborne toxins or chemical agents. There was no immediate culprit. The toxic lady case was born. But what really happened in that ER? Was Gloria's body harboring a hidden chemical weapon? Or was this some freak cascade of biochemistry gone wrong? The more investigators dug, the deeper the mystery grew. Doctors and pathologists raced to investigate. The hospital, local health agencies, and federal agencies all joined in. Multiple autopsies were performed, some under sealed conditions, given fears about contagion or lingering toxins. First, they searched for conventional explanations. Could Gloria have been exposed to industrial or chemical poisoning, e.g. gases, pesticides, cyanide? Could her death have triggered a chemical reaction in her blood or tissues that released a toxin when disturbed, e.g. in the syringe? Could environmental contamination in the ER have played a role? No clear external toxin was found. Toxicology screens failed to detect known agents in sufficient quantity to explain the cluster of illnesses among staff. The coroner's office posited that some of the puzzling odors and symptoms might be explained by metabolic breakdown products in a dying body. Ammonia, volatile compounds, tissue decomposition, amplified by the stressful hospital environment. Some argued that the fainting and dizziness of staff was mass hysteria or psychosomatic contagion triggered by panic. But that explanation failed to explain the more concrete observations. The crystals in the syringe, the sudden severe symptoms among staff, the clustering of cases, and why some staff near Gloria were affected while others farther away were not. Medical staff reported the fumes had a distinct smell, and the effects felt chemically consistent rather than psychological. The turning point came when researchers from the Lawrence Livermore National Laboratory proposed a radical hypothesis that Gloria had been using a common home remedy, DMSO, dimethyl sulfoxide. DMSO was sometimes used off-label by patients for pain relief or inflammation, though its medical use had fallen out of favor. The idea, DMSO in her body might have oxidized first into dimethyl sulfone, and under certain conditions, especially the high oxygen environment, electric shocks, or interactions with other drugs, further converted into dimethyl sulfate, a highly toxic and volatile substance. Dimethyl sulfate is capable of causing respiratory distress, neuromuscular effects, and other systemic symptoms even in low concentrations. In this scenario, when a nurse drew the blood, exposing it to oxygen or shock, dimethyl sulfate might have been liberated into the air, impacting staff around her. The crystalline particles might have been intermediate compounds, e.g. dimethyl sulfone. Supporters of the theory pointed to elevated sulfate anion levels in her blood as potentially consistent with this metabolic chain. But it's not airtight. For one, no dimethyl sulfate was ever directly detected in the atmosphere or in her body samples. Critics argue that no known human metabolic pathway reliably converts DMSO into dimethyl sulfate under physiologic conditions. The hypothesis, though elegant, rests on tenuous chemical leaps. Moreover, alternative theories persist. Could a rare biochemical reaction inside a dying body create volatile compounds previously unknown? Could tissue breakdown in the setting of advanced cancer produce toxins under stress? Could an undetected industrial contaminant or malicious exposure have been involved? Or, as skeptics propose, was this partly mass hysteria exacerbated by confirmation bias after the first staff collapsed? In public accounts, the toxic fumes idea captured imaginations. The media dubbed Gloria the Toxic Lady, and she became a staple of weird medicine lore, inspiring TV episodes, documentaries, and conspiracy buzz. But in scientific circles, the case remained unresolved, intriguing, baffling, and imperfectly explained. Until recent years, the case languished as a medical oddity, discussed in forensic science circles, but rarely revisited. Yet the questions it raises still resonate. What hidden chemistry lurks in extreme pathophysiology? How reliable are our assumptions about metabolic breakdown? And what happens when a patient becomes, unexpectedly, the peril? Let's pause, because here comes a twist. While Gloria's case remains unresolved, there is another real medical mystery with similar veils of secrecy: the poisoning of Zhuling in China. Her case offers a compelling contrast and may sharpen our sense of what's possible. Zhuling was a promising chemistry student at Tsinghua University in Beijing in the mid-1990s. In late 1994, she began suffering sudden stomach pain, hair loss, neurological symptoms, muscle pain, paralysis, odd sensory findings. Doctors in Beijing were stumped. In April 1995, her friends posted an SOS description of her symptoms to Usenet, hoping outside physicians would weigh in. Many responses zeroed in on thallium poisoning. When tested, Zhu's hair and urine samples revealed elevated thallium levels, confirming poisoning by a rare heavy metal. But here's the shock. Mass spectrometry reanalysis years later showed she had been poisoned in multiple doses over time, likely escalating exposure rather than one single event. Zhu survived, but was left severely disabled, dependent on care. The police suspected her dorm roommate, Sun Wei, aka Jasmine Sun, had access to thallium, but lacked conclusive proof. The case was closed in 1998 for lack of evidence. No charges were filed. Zhu passed away in December 2023 after decades of suffering. The comparison between the two is stark. One case hints at bizarre internal chemistry converting benign molecules into lethal gases. The other is a clear case of external poisoning, yet still unresolved in motive and perpetrator. Both expose gaps in forensic and medical science: unknown metabolic reactions, weak detection thresholds, bureaucratic inertia, or lost evidence. Now, return to Gloria. The DMSO dimethyl sulfate hypothesis remains the leading scientific theory, but many accept that the case cannot be closed definitively. Some researchers have argued that the symptoms and clustering are best explained by a combination of volatile metabolic byproducts, tissue breakdown, oxygenation reactions, electric shocks, and perhaps unknown intermediate compounds, but concede that this model is speculative. In fact, in a later press statement, the coroner's office acknowledged that no external toxic substance had been firmly identified, and suggested that the odors may have been residues of a dying person, endogenous compounds liberated during cellular breakdown. Yet they admitted that the intensity of the effect, the ability to incapacitate medical professionals, was unprecedented. So what do we conclude? That Gloria's body may have harbored a hidden chemical cascade, that the hospital environment may have triggered an unexpected reaction, or that we simply lack sufficient data: missing tissue samples, lost evidence, incomplete atmospherics, no real-time gas detection from that night. Whatever the truth, one fact stands. Gloria's death did more than take a life. It inflicted injury and trauma on those who came to help. It exposed how little we may understand about the boundary between biology and chemistry, and the dangerous frontier when a dying body becomes unpredictable. As we draw this story to a close, I want you to imagine being in that ER that night. The soft hum of monitors, the muffled commands of doctors, the sudden collapse of colleagues, the sickly odor, the shimmering sheen on skin, the sense that something inside a patient had turned lethal. A hospital is meant to be safe, yet that night it became ground zero. Gloria Ramirez's case remains officially unresolved. No single explanation has satisfied all anomalies. The DMSO to dimethyl sulfate theory is compelling but unproven. Critics argue the leap is too large. The competing notions, metabolic breakdown, unknown biochemistry, mass psychogenic effect, each have their contradictions. The truth may lie somewhere in the overlap, or perhaps in something we haven't yet discovered. Medical science demands evidence, and in this case, the evidence is fragmentary, contaminated, or simply absent. But that doesn't make the mystery any less real. Indeed, it makes it more haunting. In the end, the toxic lady stands as a warning. Our bodies are chemical machines. When they break, they can misbehave in unpredictable, terrifying ways. Even hospitals, sanctuaries of care, can become deadly arenas when nature's boundaries blur. If a dying body can turn into a source of airborne poison, what else lies beyond our current knowledge? What other conditions exist where internal chemistry meets crisis and slips beyond detection? Gloria's death invites us to ponder that boundary and to respect how much we still don't know. So tonight, as you ponder this strange case, ask yourself, in every patient we treat, are there chemical secrets hidden beneath the flesh? Are there transformations we cannot yet see? And do we need new ways to monitor, to detect, to respect the danger inside? This is not just a cold forensic puzzle. It is a human tragedy, a test of scientific humility, and a ghost story whispered at the frontier of medicine. Thank you for following this journey. If you enjoyed this kind of deep dive medical mystery, let me know. I'd love to explore Zhu Ling's story next, or other unresolved cases from medical history. Until next time, stay curious, stay cautious, and never forget that even in the simplest body, chemistry can hide its shadows.